Hi Marie, how you doing?
I'm okay.
You okay?
Okay.
I was hoping today, if you're okay with it, we could try a particular technique that I think will help you to exercise and understand how you can somewhat control your emotions.
Okay.
Would you be okay with trying
Sure.
that?
Yes.
A part of this technique can be a little distressing in some situations. If it becomes too distressing, just stop and tell me to stop,
Okay.
and we'll move on to something less distressing.
Okay.
You okay with that?
Yes.
All right. So this is called the push button technique,
Okay.
and it has two parts. And I'm going to want you to reflect on two different images and tell me, as you're reflecting on the image, what you're feeling, like right now in this moment, what you're feeling, and to some extent what you're thinking.
Okay.
So the first image, I want to be a more negative image, right? An image that maybe, in your case, because we talked about anxiety, maybe an image that provokes anxiety.
Okay.
Do you have an image that might work for that in mind?
Yes.
What's that?
Seeing a spider.
Seeing a spider?
Mm-hmm.
Not a big fan of spiders?
Terrified.
Terrified of spiders?
Terrified.
All right, so strong reaction.
Yes.
All right, so can you imagine in kind of a concrete way an encounter with the spider?
Yes. I just encountered one this week, so.
Just this week?
Mm-hmm.
All right. So go ahead and give it a few seconds and kind of recall that image. Kind of play that back a little bit. And then tell me what you're experiencing.
My chest is heavy. My heart's pounding. I just want to jump up and leave the room.
All right, so a lot of anxiety.
Yes.
Right.
A lot.
We talked before in other sessions about scaling, where anxiety can be scaled from 1, which is no anxiety, to 10, which is the most you've ever experienced in your life.
Mm-hmm.
Where are you right now with your anxiety?
I have 5 or 6.
It's like a moderate level?
Yes.
All right. So you have a feeling of anxiety and a kind of a thought that you could just jump out of this chair
Yes.
and run out of the room.
Yes.
All right. So this is a bit scary for you.
It is. I am terrified.
You're terrified.
And I don't see one, but thinking of one and thinking of past experiences, yes, I get very anxious.
All right. So having that image in your mind.
Mm-hmm.
All right.
Yes.
So let's move away from that.
Okay.
All right. And we'll move to the second phase of the push button technique. And for this phase, I want you to do the same thing, except the image will be one that you associate with being satisfied, happy, not anxious. One that gives you maybe more of a sense of belonging, achievement, something oriented in that direction.
Okay.
Anything you could think of that would be a suitable image for a positive image?
When I was around 40, it's more of a milestone in that time of my life.
Mm-hmm.
I was entering grad school and just being happy where I was at in my life at that point in time.
So what's that feel like right now as you recall that milestone?
Content. I'm happy, relaxed.
How about your anxiety level?
Probably a 1.
1?
Mm-hmm.
So much different than you felt a few moments ago.
Absolutely. Completely different.
So is there anything that you think that you've learned from exercising this technique, looking at kind of both sides?
Well, if I think of something, a negative or bad experience, it produces anxiety, or how I felt when I actually, like when I see the spider.
Mm-hmm.
And then when I had to think about the milestone at what it represented and how my life was, I immediately was happy and felt happy and was thinking of all the positive that represented in my life. And it just completely calmed me.
So these images, both in the negative and the positive, can have, and the thoughts that are associated with the images, can have a fairly profound effect on your mood.
Yes.
So you picked up what I was hoping you would pick up, which is that we have a good deal of control through the choices we make in terms of what images we want to focus on, what images we want to bring to the forefront. We can exercise control over emotions. Does that make sense?
It does, now that I've had to compare the two.
So what I'd like you to do between now and I see you again is let's not worry about any more negative images.
Okay.
Just try to avoid those, and think of some more positive images. Particularly, well, you can do it any time, but particularly when you feel like your anxiety might be becoming a little escalated.
Okay.
Right? And I think it's good to have those images kind of spelled out in advance, like that milestone is one.
Mm-hmm.
That's one that kind of, I think you used the word content.
Mm-hmm. Yes.
So that could be a powerful anti-anxiety type of feeling, right? So that image is consistent with not being anxious. If you have some others that you could have ready, and think of it just like the technique is described, push button, right? You bring that image in, and you're experiencing the emotion associated with that image.
Okay.
Right, just like pushing a button. So you push a button, the image comes up, and you can even think of it that way. Mm-hmm. And then you have what I hope would be a more pleasant emotional reaction.
Okay. Yeah, I think I can try that.
You can try that? Does that make
Definitely,
sense?
yes.
Okay. So try that out as needed, again, especially when anxieties get a little elevated. And then I'll see you again next week, and we'll build from there.
Okay.
Thanks, Marie.
Thank you.